Community Medical Centers is being proactive when it comes to making sure everyone feels safe and supported when receiving medical care. Dr. Drea Long explains how they're doing it for those who identify as LGBTQ.
I think it's very important that as a community that we have a level of cultural sensitivity to a very unique population, which is the LGBTQ population, so lesbian, gay, bisexual, transgender, and queer population. There's not a lot of education in medical school or in residency about how to ask the appropriate questions and be able to provide the best health care that we can for these patients. So I think there's an education gap that we can be able to fill. I think, first of all, assuming that not everybody who comes into the office is a heterosexual patient, and being able to ask, what is your gender identity? What is your sex assigned at birth? Because those may be very different than what you assume from their presentation. Because otherwise if you have never taught how to ask the question, it can be a very uncomfortable experience for people who don't have that much experience with this particular population. So I think if you train somebody how to ask questions in the right way, it can ease their comfort level, and then that translates to your patient relationship. I think it's very important because if you don't ask the right questions, patients are not going to feel comfortable disclosing what can be vital information for their health care, for their needs. It helps you identify what some of their healthcare disparities, what their risks might be, and most importantly, you just don't get a very good patient-provider relationship if you don't ask the right questions. One of the things that we're doing is trying to improve our electronic medical records so that we can actually capture the right information once we make sure everybody knows how to ask the right questions. And this will help us be able to communicate that information as well in a much more easy fashion, so that the questions don't have to be asked over and over again. Overall, just making sure that our waiting offices are more friendly to gender non-binary and transgender and LGBT. So that can be as simple as making sure that you have information up on the walls, magazines that show that this is as much of a part of the population you're trying to capture and take care of. Having the gender neutral bathrooms, I think, is very important. Having a safe space for people to go to and recognize. I think it's also very important, as clinicians, we can provide care, but if the first thing that a patient sees when they walk into an office is an intake form that only lists male or female, that doesn't give options for preferred name, it doesn't matter what kind of care I can provide the patient, that's gonna immediately start to have a negative impact on my relationship with the patient. Feeling like they've been respected as a person and been treated with as much respect as anyone else in the community, and felt like that their healthcare was appropriate.